I contacted a local lab for blood draws and that kind of stuff to see kind of tests that I could order for my patients to see if they have autoimmune attack. I got back pages and pages. They have the technology. They can test for autoantibodies to all kinds of different tissues, but the doctors are not ordering these tests.
I was just asked the other day by someone new to us if I was the forbidden doctor. Of course, I said no. The forbidden doctor is not me at all.
We are not the forbidden doctor. Jack is not the forbidden doctor. It's in you.
The forbidden doctor is that magical, mystical power inside of you that is controlling and healing
It's
everything.
that beautiful, marvelous, almost miraculous force that controls all healing.
It's that innate intelligence, that life force-directed influence that triggered your DNA to guide the building of your body after conception.
Yeah, it's that power that sustains your life, repairs your wounds and lesions, and it never stops working. It's that essential part of you that keeps you alive and heals your every hurt.
This is the forbidden doctor. It's not me. It's that part of you the powers that be have decreed forbidden to ever learn about or even consider, and never ever rely upon. For it is forbidden that you even know this life force exists at all.
You are your own forbidden doctor.
Yes.
Hey everybody, it's Dr. Jack.
And Mary.
And welcome back to the Forbidden Doctor podcast. This is podcast episode 189, The Forbidden Secret to the End of Autoimmune Disease.
Today, we're going to talk about some forbidden and, I'm telling you, unbelievably suppressed information about autoimmune diseases that's been hidden away from you for way too many decades. We're going to introduce you to one of the greatest gifts to humanity from Dr. Royal Lee.
Yeah, but before we get started, we just want to take a moment to acknowledge the sponsor of the Forbidden Doctor podcast, Cashback World. Now, are you worried about never being able to retire? Well, we are, I guess.
Yeah.
We just couldn't see a way to ever retire from the daily grind of the office and 60-hour weeks. We want more time for these podcasts and research and then obviously just to travel and relax a bit. We've gotten very excited about this Cashback World as we've studied it more, and it's simply a way to make money off of something people have to do anyway, shop.
Yeah.
So how would you like to make money off of other people's shopping? Well,
significant money.
Yes, ma'am. Well, we've got 2 new great videos for you. They're just 3 minutes long. If you go to whynotgetcashback.com and watch them. Over there, of course, there's
we have another new one, longer one.
A longer one that'll explain everything. But the first 2 intros, they're 3 minutes long. It'll give you a basic idea of what we are talking about.
So again, go to whynotgetcashback.com, and there's 3 videos on there I think you'll really enjoy. They're brand new. So we're going to break for a moment.
Yeah, and we'd like to welcome another mentor of ours. In the standard process philosophy. We're going to be talking to Dr. Lowell Keppel.
Dr. Keppel is the one I take the most notes from when I listen to him on seminars, mostly because he is funny and relaxed and he doesn't take himself too seriously, but he is one of our brilliant mentors, and his understanding of Dr. Royal Lee, and that's what we're going to talk about today, Dr. Lee and his stunning discovery of autoimmune diseases in the early 1940s, decades before there was even a word for autoimmunity. Actually, the first time autoimmunity ever appeared was not until the mid-1960s. They talked about it, but it wasn't really in the lexicon of our verbiage, in our medical verbiage. In 1988, they finally admitted autoantibodies increase in old age. In 2013, they admitted autoantibodies actually make us age. That was in a Trends in Immunology magazine. And then in 2016, they talked about tuberculosis and infection initiated autoimmune disease. So Dr. Lee was reviled and laughed out of the medical community. I mean, the medical community said to him, your body would never attack itself. and Dr. Lee would say, well, it does. I can show you how. Come over here and I'll show you. But of course, the medical society would never even look at it.
Yeah, and over 100 years ago, the idea was tossed around that maybe in advanced sickness, the body's own immune response would somehow get in the way of healing. But at the start of the 20th century, Paul Ehrlich, Nobel laureate, of course, coined the term autotoxicus to emphasize that autoimmunity would contradict nature's aversion to self-injury. That's their tech.
Yes, their street terms for the body would not hurt itself.
Yeah, the body wouldn't hurt itself.
Yeah.
But at the start of the 20th century, when this first came out, it was in Dr. Ehrlich's early examination and research of all of this. But the NIH, through some research that was paid for, finally ended up substantiating Dr. Lee's concepts that he talked about in the late 40s, early 50s. And and I'm going to quote from an NIH study here for a second. The investigators were positioned to invalidate autotoxicus, which was Dr. Ehrlich's term, but lacked sufficient convincing experimental and clinical evidence to accomplish the task. Seminal studies of chronic thyroiditis, like you would have with Hashimoto's, and a series of clinical laboratory breakthroughs led to the general acceptance of autoimmune disease in the 1950s, end quote, which was validating what Dr. Lee previously had taught for over a decade.
Yeah, and one of those statements decades ago, Dr. Royal Lee said, old age in general is probably the development of these antibodies, one after the other, to one specialized tissue after another.
Yeah, so, and what he was saying is back when autoimmunity was not only dismissed, but rather violently disbelieved, he was saying in words to the effect that the aging process itself was not a whole lot more than just the body attacking its own various organs in their growing dysfunction brought on by increased malnutrition.
Yeah. So Dr. Lowell Keppel
is here
to explain from the writings of Dr. Lee and some fascinating new information he has discovered, because he has been a student of Dr. Royal Lee for decades. That Dr. Royal Lee discovered about autoimmune diseases and protomorphology. So welcome, Dr. Keppel.
Yeah.
Thank you, guys. That's awesome. And you're saying a lot of really kind words about me. I appreciate that.
Yeah, well, I'm going to call you Dr. Keppel all the way through because I can't say Lowell.
You can. Very good.
Yeah, somebody needs to turn their phone off.
Oh, mine's off.
No, okay. They're alert.
Okay. I think. Oh, maybe. So, welcome. Tell us a little bit about yourself and why you have jumped in.
Yeah, where you ran across Dr. Royal Lee and autoimmune processes and
this new idea that you have found researching with
Sure. You bet. So I'm a chiropractor in Denver, Colorado, suburb Westminster, actually. And I've been a chiropractor since 1984. And in 1989, I went to a standard process seminar where I learned a great technique called contact reflex analysis. And it's a muscle testing technique to get information from the body. And that started me on my journey of learning about standard process. And then as time went on, and I saw changes in my personal health and changes in my patients, of course, I started learning a little bit more and more about the standard process formulas. And
it ruined us, right? Because we can't use any other company.
It did ruin us because
I know.
Once you get the Lee philosophy that we should get our nutrition from this wacky stuff called food, well, now all of a sudden you take a look and go, why do I want to put these man-made chemicals in my body?
Yeah.
And so, like I'm sure you guys have talked about, ascorbic acid is not vitamin C, right?
Oh, many times.
That is our podcast.
And so once that philosophy hit me, it was like a snowball. And, it just started off as a little snowball. And then I had to learn a little bit more. And then, of course, you get some patients that don't pan out the way that they should. They're not getting well. So you got to learn a little bit more. Mm-hmm. And, now you get caught up in this avalanche And at some point in time, you realize the true genius of Dr. Lee and his understanding of biochemistry and nutrition. And then you hit upon, like you guys were talking about, the protomorphogens in autoimmune disease.
What a gift to mankind.
Yeah, if mankind would only accept it, right?
That's
what we're doing. That's
the forbidden doctor here.
Yeah. Thank God for your podcast for people on this.
Yeah. Well, that's what we want to delve in today. And you have found, we have talked about protomorphogens a lot on our podcast and autoimmune disease and the, autoantigens and everything that stops autoimmune diseases. Then you have to get in and heal the body with food. But you have discovered a really unique side after reading and studying Dr. Lee's
what we ought to
writings.
do is define what a protomorphogen is.
Okay.
Yeah, and I think we should keep it simple too, Jack. Because
just talk to the man on the street. Exactly.
Right. And so the protomorphogen is the nucleus, the DNA of the cell. And what Dr. Lee found was that these DNA, nucleal proteins, cytotrophic factors, there was a lot of different interchangeable words floating around during Dr. Lee's time and when he was talking about this in 1947. So getting some of the nomenclature, consistent. And what he found was that we could use this protomorphogen, this cell nucleus, from other animals to ingest into our bodies, which would now act as a decoy to take the immune assault off of a specific tissue.
And give you what?
And give you an opportunity, a window to recuperate.
Yes, time. It gives you time. So that's the part that the medical society never addresses at all.
Yeah.
Why would the body attack itself? Why would we have to come up with something to stop the body from attacking itself? Like in lupus, it's almost every organ is under assault by the immune system. Arthritis, the joints are under attack.
Right. And like one of our other mentors, God bless him, and, rest in peace, Michael Dobbins would say, stupid body, right? Stupid body for attacking itself.
Yes.
The horror, what did he call it? Horror autotoxicus?
Yeah, that's what Dr. Ehrlich called it, yes.
Yeah, and just like Dr. Dobbins would say too, is the body's doing exactly what it needs to do given the circumstances.
Yeah.
And so how does this autoimmune situation start off? Well, you've already alluded to it, Jack, by talking about infections. Chronic infections. Mary talked about the tuberculosis. Well, that's a bacteria, and that bacteria is causing such damage to the lung tissue that all these lung cells are dying off, and now the body's garbage system can't clean it up.
Yeah, because an autoimmune is a process. It's not just a disease. For instance, tuberculosis initiates an autoimmune process, but it's not an autoimmune disease, though any disease, including tuberculosis, becomes an autoimmune disease because it's caused by an infectious agent, but that infectious agents and that infection causes the process of autoimmunity if it's not healed properly.
Correct. And so now another thing that we have is trauma, right? There's no trauma in today's world. People aren't getting in car wrecks.
Those football players, those concussions, they don't do anything.
Those concussions aren't that big a deal, right? No, of course. I mean, so how much trauma has to occur to cause an autoimmune cascade, an autoimmune effect? And like you said, Mary, autoimmune disease is not the disease. It's the end result. Of all the assault on that tissue.
And the breakdown and the...
Well, let's give a real practical example here. And let's use concussion.
Yeah.
Concussion to the point where, the brain is surrounded by a sea of water that's contained inside the dura to insulate it. Just like, if you picked up, you're shopping in the supermarket and you pick up a can of pears and you happen to drop it on the supermarket floor and it dents the can. But if you opened up the can, the pear will still be intact. because it was protected by the fluid that was in there. But if you kick that can hard enough, you're going to damage the pear. If you are struck in the head through an auto accident, a football, targeting, whatever, is hard enough, that sea of water that covers the brain is not going to be enough to insulate it from the skull. And the cortex, the outer surface of the brain, is going to hit that obstruction called the inside of the skull and bruise it, hurt it, tissue damage. Something is going to happen to that neuron, the neurons in the cortex. So what happens if you get enough damage of enough of the brain tissue?
Yeah, and so what happens is I've got so many cells that are dying off that it overwhelms my lymphatic system, the sewer system of the body, and now I have these cell proteins, DNA, leaking into the bloodstream, and that's where all hell breaks loose. That's when things get crazy, and so the immune system has to get involved, neutralize these proteins that are going places they shouldn't be going. And if the body doesn't shut off that mechanism, now it's going to trace it all the way back to the origin of the cell destruction, which in the case we're talking about is the brain. And now it's going to start attacking the brain. By the way, what's the number one activity for concussions in America? You're going to love this.
The number one cause of concussions in America?
Yeah.
Well, I assume the obvious is not the answer. Car accidents.
Correctamundo.
Childhood sports. Because I have children I take care of that are getting concussions before puberty.
Yeah.
Simply because of soccer.
Right. And that's also a good guess. Bicycling.
Oh, of course.
Really?
Like of course. I have patients. I have a lady I just started last week.
Yeah.
Who wrecks 2 to 3 times a year up in the mountains with her mountain biking.
Well, but that's weird.
And she feels like there's something really wrong. She says, I don't hurt anywhere. She says, once the bruises heal and the cuts and scratches heal, I should be okay, right? But I don't feel okay. Yeah. And someone referred me to you.
Right.
Now, the way it was explained to me actually by Mark Anderson, who's the president of Standard Process West. In fact, I remember where I was driving when I pulled off the road and listened to him explain, when the protomorphogen, the autoimmune effect is when your bloodstream is not a sewer system. Your lymphatic system is what takes out all of the...
Yes, he was saying here.
Yes, that's what... Yeah. And so when that gets overwhelmed, it seeps into the bloodstream. And my theory behind this also is that our collagenous fibers, when we get older, become so weak and almost leaky. They're not tight and strong like, little kids, that it literally can leak in easier as we get older. And of course, you cannot have proteins in your bloodstream. I mean, the body just goes on red alert. And is it because theoretically, let's say you have heart disease and it's sloughing off more dead and dying cells than your lymphs can handle, seeps into the bloodstream, the body goes on red alert. Is it because you could theoretically start growing a heart somewhere in your body or eyeballs in your pancreas or...
Yeah, absolutely.
Is that why? And so it's so bad that the body goes after it with a vengeance and said, where did this come from? Well, it knows where it came from because it's got the DNA in it and it zips to the heart or zips to the brain or zips to the skin or whatever else and says, this is the enemy.
Right. Right.
When we eat proteins that we're allergic to and they leak through our leaky gut, you can just stop eating those proteins and
right.
Fine, but you can't stop your pancreas from being there, or your brain from being there. So that's why autoimmune diseases are so lethal.
Well, and you brought up another good point, and I'm not sure you even realized what you were saying is as we get older, mm-hmm. our connective tissue becomes weaker and maybe develops, let's just say, holes in it.
Yeah.
Right? But all of your tissues are involved or enveloped in fascia. And some fascia has even gotten specific names, like the fascia around your liver that keeps your liver where it's supposed to be, has its own specific name because of the guy that discovered it. I think it's like Gleason or something like that.
Yeah, all our organs are surrounded in fat.
Right. And so if that fascia, which is connective tissue, now starts losing its elasticity, the protomorphogen that is in the fascia and in the connective tissue can now leak it into places it shouldn't go. So that actually brings up something that I think is interesting is Dr. Lee talked about two different types of protomorphogens. There's two different types. There's the exogenous protomorphogen. That is what we eat. That's what we take in our diet in the form of a supplement or when I'm eating animal tissues. Mm-hmm. And it has to be from a mammal, by the way. I cannot take a reptilian tissue and have the same effect. It has to come from a mammal. That's the exogenous protomorphogen. Then we have the endogenous protomorphogen, our own protomorphogen, which is our own blueprint. Mm-hmm. It actually will leak out of the cells of the organ, and it will hang out in connective tissue, waiting for non-programmed proteins to come along so that the protomorphogen can basically program that protein and go back into the cell to reproduce healthier cells. That's your blueprint.
So
as you get older, if your fascia is developing, quote, some holes in it, now that's another reason why it can leak into the system, and that's why aging can be an autoimmune effect.
So animal foods help us in many, many ways. First of all, enable us to rebuild the collagen in our body with the protein and the fat, so we don't have the weakened veins and capillaries and all the different parts of our bodies, the fascia, everything. So that helps us. And then if we would eat the organ meat, which we used to eat when we didn't have autoimmune diseases rampant everywhere. If we ate heart and we ate thyroid and we ate adrenals and we ate heart.
Correct.
That could also prevent this, even though I'm not supposed to say the word prevent.
Right. It could have a very positive effect on the body. Now, what's interesting about these exogenous protomorphogens is they cannot be blueprints for us. Otherwise, if I ate lamb heart, for instance, like Dr. Lee talked about a gentleman with a heart problem in Florida eating lamb heart. If I ate lamb heart, for instance, if that was a blueprint for my body, I would eventually turn my heart into a lamb's heart, which is not the proper blueprint for me. But Dr. Lee also talked about in the case of muscle, the protomorphogen would be called cardiotrophin. And he said that it was like 2 to 4 tablets of cardiotrophin equals the same amount of 2 to 4 pounds of the heart muscles that you would have to eat.
Wow.
So let's in talking to the man on the street here, or the woman on the street, why would they want to, what would be going on that they would need to take a protomorphogen? And what would they expect that protomorphogen to do for them?
Well, that's a good question, Jack. And how do they know? How do they know what if they need a protomorphogen? Well, one of the biggest things I think that a person would find is that chronic inflammation. So many healthcare practitioners now are treating chronic inflammation, and they're downregulating inflammation with omega-3s, omega-6s, turmeric, different herbal kind of things. But turmeric seems to be the big one right now. And my attitude is downregulating the inflammation is fine, but don't you want to know where that inflammation is?
Yeah, the cause of it.
What happens if you stop the downregulation? What happens when you stop the anti-inflammatory effect of turmeric or a pharmacological prescription for an anti-inflammatory? What happens when you stop taking it?
Yeah, you're talking like the steroid injections and that kind of thing. Well, we know what happens over the course of time. It just comes back again.
Yeah, the inflammation starts right back up again.
Inflammation is not the dirty words doctors say it is. Inflammation is your body sending blood to a part of the body that needs to heal.
Correct.
How else do we heal but by our blood?
Yeah.
So
but when the healing doesn't happen.
Right, when it's chronic ulcers, chronic.
Yeah, chronic joint pain.
You have to figure out the reason for it.
Reason for it. Yeah. Back to the chiropractic philosophy, getting to the cause.
Right. So I'm still a little, I still want this explained a little better. This exogenous and what was the other one?
Endogenous, exogenous.
So if we eat lamb heart, it will support us and divert antibodies that might be attacking our heart, but it won't turn our heart into a lamb heart.
Correct. Because that protomorphogen, that DNA never makes it that far.
Right. Dr. Lee says that often in his writings.
Yeah, absolutely.
So you can get the protomorphogenic effect from lamb heart, but you don't have to worry about it because the actual DNA, the nucleic acid, the DNA that created a lamb's heart, is not going to get into your bloodstream.
It's not the blueprint.
Right.
No. And there's a kind of an interface that occurs in the lining of the gut.
In the Peyer's patches.
Yeah, in the Peyer's patches, a very important part of the immune system towards the end of the small intestine.
Yeah.
And what happens there? Suppose I was diagnosed with some cardiac issues, like maybe I had my mitral valve wasn't working as well as it should, or I had some weakness in the myocardium, or I started to have an enlarged heart, or someone said I needed a pacemaker or things like this. While I was still listening to my cardiologist and doing what my cardiologist told me to do, I might take a protomorphogen along with it. What would I expect from that?
So the exogenous protomorphogen, the one that we eat, okay, I'm not going to eat my own heart.
Right.
But the exogenous one that I eat from a mammal is not going to act as a blueprint for me. What it's going to be is the decoy. So with Jack in the heart issue, I can take this protomorphogen, and what can I expect? Well, if I'm having a severe autoimmune attack on my own heart, which medical science has proven in AFib and enlarged hearts and that kind of stuff, there's an autoimmune component, I can expect a histamine reaction because the immune system, my T regulatory cells are going to tie up that protomorphogen in the Peyer's patches, which is the lymphoid tissue around the small intestine, like Jack was talking about.
The galt.
It's going to tie up that protomorphogen there, and it's going to say, wait a minute, you're like a bad guy. You're like an allergen. I can't let you into the system. I can't let you into the country because you don't have the right papers here. And so I'm going to neutralize you. And when I neutralize you, there's going to be a histamine reaction. So I can develop a histamine reaction, which for me, the patient, I'm not going to enjoy. I might feel like I'm getting a cold. I might feel like I'm getting sick. I might feel like I'm getting a headache because my body's got to clear out these histamines of my immune system, neutralizing the protomorphogen that I'm ingesting.
That's why we recommend taking them at night sometimes, so that histamine reaction happens at night.
Yeah. So those are some of the symptoms that I would see.
And that oral protomorphogen you're taking, like cardiotrophin PMG, diverts the autoantibodies that are attacking your heart and gives you time to rebuild your heart.
Right. And so you have your own blueprints, your own DNA, that is going to be around this connective tissue of the heart. So still within its encased fascia, so that now the heart and all the heart components are where they need to be, and they're not leaking out into the bloodstream or over near the liver or anything like that, because I don't want heart cells growing in my liver, right? Right.
Because they're not being attacked anymore. Is that why you're saying?
Well, that's the blueprint. That's how my body naturally knows how to make healthier heart cells. Does that make sense?
Yeah. So what you're saying is those protomorphogens around the heart or the liver can do their job when they're not being attacked by autoantigens.
Correct. Absolutely.
Okay.
Yep. Now they have a chance to rejuvenate because, like you said, they're not being under attack all the time.
This is fascinating.
Yeah. Now I want to get more simple here. I want to get as simple with this in the explanation that we can, because when you were talking about various kinds of heart disease that have an autoantibody aspect to it, in other words, the heart may be under attack by the immune system, leading to arrhythmias or some other problems. The DeBakey Institute in Houston, Texas, said that all heart disease is essentially an autoimmune attack. Now, when someone is having some kind of organ dysfunction, they got problems with their liver, problems with their kidney, the lungs, and they go in for medical testing, medical evaluation, something that, based on what you're saying here and based on what current medical research in the area of oral tolerization would indicate, they should be also getting a test to indicate the presence of autoantibodies.
Right.
Like if someone had a severe concussion,
right,
and they'll go get an MRA or an MRI looking for a brain bleed. They'll be looking for some kind of imaging that could indicate or be more indicative of some kind of damage to the brain. But would they also be doing a blood test looking for antibodies that your own system has created?
Right. Yes, Jack.
Against the brain itself? I don't think they're doing that, except in certain areas of autobody research.
Very rarely. And I contacted a local lab for blood draws and that kind of stuff to see what kind of tests that I could order for my patients to see if they have autoimmune attack. I got back pages and pages. They have the technology. They can test for autoantibodies to all kinds of different tissues, but the doctors are not ordering these tests. And from what I could tell too, they're not very expensive. Now, my plan is to do a little bit more research in this area because we are dealing with autoimmune situations on a daily basis with patients that walk in. And sometimes we need to have a baseline of how severe is this or where we're at to see if our treatment outside of the patient saying, yes, I do feel better, that it's actually working. And so, yeah, we can order blood tests to check for autoantibodies. And I think we need to be doing that more. Now, the medical profession doesn't really do that. In my opinion, you want to know why?
They're still catching up.
They don't have anything to treat this with.
Well, that's the problem.
Yes.
And so if you go Google oral tolerization, you'll see where some rather impressive medical schools have looked into this and have discovered the autoantibody. Now, an antibody, if I am exposed to a flu virus from somebody who's sick in my immediate, area or my neighborhood, whatever, within a week to 10 days or 10 to 14 days, I'm going to have antibodies to that particular flu virus that my immune system is going to make anyway. And that's for an antigen that is coming from outside of my body, and it's in my bloodstream, and my bloodstream says, that does not belong here. We have to destroy this as fast as we possibly can. It takes a little while for the T cell to send out the markers for the B cell to make the antibody, but it eventually does. And when it does, if I'm ever exposed to that thing again, I probably will never even know it because the immune system tagged it and destroyed it before it becomes infective inside of my own body. Now, with that having been said, what modern medical research over the last 2 decades, because they've been working on this for some time, is that they discovered these autoantibodies. An autoantibody is an antibody that your body makes against the specific tissue inside of yourself. Yeah. And so they found out that when they were using various aspects of immunotherapy, they could stop the immune system from attacking the liver, from attacking the kidney, the ovary, the lung. But as you said there a minute ago, They had no idea what to do next.
Well, they hailed it as the greatest discovery of all time, but they found that it only lasted a little while.
Yeah, well, they didn't know the next step.
Cure anything because they don't understand nutrition. They don't understand that you have to support and rebuild your body with the correct foods.
So they could stop the inflammation.
Right.
You know, and even in organ transplants, somebody goes and gets a liver, you know, they can stop the body's attack against the liver to reject the liver. In a more gross example, but when your body's attacking your own liver, they can stop the attack against your liver, but they can't stop the reason for your body attacking the liver because, as you said, nutrition never enters into the picture.
Correct.
And so oral tolerization is, it's been shelved.
Yeah. So the part that we're giving you, the forbidden part, is that, yes, the cardiotrophin PMG, the neurotrophin PMG, the pancreatrophin PMG.
How many PMGs are there? There's like 21. 17. There's 17?
I think.
I thought
they will stop the autoimmune attack. You'll feel better. But then you've got, all they do is give you time. And so you've got to get in and feed that heart. You don't feed that heart with lettuce. You don't feed it with broccoli. You feed it with animal foods, preferably organ meat. And we have a lot of therapeutic supplementation you can do to feed it.
Right.
But you can also just feed it with
And we have other podcasts on this subject.
And then the autoimmune disease goes away.
Yeah, because the body no longer finds the enemy floating around in the bloodstream. You think I could use the day the earth stood still example again? That's such a great example.
Whatever.
Dr. Keppel, are you familiar with the movie The Day the Earth Stood Still?
Go ahead.
The flying saucer, and I like the old Michael Rennie version from the 1950s.
He's old.
The flying saucer comes through the sky and lands on the mall there in Washington, D.C., and this alien comes walking out who, looks like a college professor. Comes walking.
Sci-fi.
Yes, it's one of the best. Comes out of the flying saucer, and behind him comes this big old gigantic robot and called Gort. And there's a small attack done by, some guys trying to move up the military authority line by taking a pot shot at the newly arrived alien. And this robot just causes great destruction and havoc immediately trying to protect this guy. Well, throughout the whole story, this guy is trying to warn the world, you guys can have all of this nuclear aggression between yourselves, but do not take it into space. Because if you bring your aggressive behaviors and nuclear weapons into outer space, we will destroy you. So I'm just here as a warning to tell you not to do this. And this big old robot beside me, let me tell you something about him. And this is your immune system. So he says, we created this race of robots and we gave them power over us. And they go after the aggressor. It doesn't matter what their religion or their belief or their political persuasion or anything else is. They immediately go after the aggressor, and the results of that are too terrible to describe.
They aggressively kill them.
So, yes. So we have learned to live in peace. So anybody who's seen that movie can understand what I'm talking about here, because that's what your immune system is.
Right.
Your immune system has no religious orientation. It doesn't meditate. It doesn't care who's running for president. When it sees the aggressor, it goes after it. And one of the main aggressors in human physiology is an active protein that got loose in the bloodstream. Right. Why would it worry about that? Because that protein will react with something.
Yes.
Yep.
Now, the major protein in our bloodstream is just albumin, just egg white. And it's an inactive protein. And it flows through the bloodstream without any problem, so the body can deliver protein substances wherever it wants to throughout the system. But when you get an active protein, like you go outside in spring and get a bunch of ragweed up your nose, it's going to get through your lung tissue and some other tissue and get into the bloodstream. And it's going, cause a severe sneezing fit and everything else. And the histamine you talked about earlier, the runny nose, the itchy, watery eyes, the itchy skin, as your body goes into a reaction to this protein in the bloodstream. Now, as we get older, and we alluded to this earlier, The fact that the organs don't work as well as we get older, simply the main reason is malnutrition. They've been fed the standard American diet. You're lacking essential amino acids, you're lacking essential fatty acids, and you're lacking very important nutrition aspects of certain minerals and enzymes and coenzymes and a few other things that are absolutely necessary for your body to work right, so it doesn't work quite as right.
But you don't supplement.
Yes, you have to supplement. And tissue begins to slough off because it starts to die. Mm-hmm. And this tissue sloughing off has active proteins in it, the aggressor that this robot Gort talks about. Right. And when that gets in the bloodstream, your immune system goes nuts. The 5-alarm fire does everything it can to suppress it. And if it's a temporary thing, fine. But when it's continual inflammation, the body starts looking around, where in the world is this stuff? Oh, that's where it's coming from. Right. It's coming from the heart. And so it sees the heart as the enemy and begins to attack the heart. The standard medical approach, well, maybe you need beta blockers, maybe you need calcium channel blockers, maybe the adrenals, we have to slow down the adrenals effect on the heart. Mm-hmm. We have to give you anti-arrhythmia drugs, whatever, rather than feeding the heart so it can rebuild itself, because no organ in the body responds faster to good nutrition than the heart does, in which we can demonstrate with the heart sound recorder.
Absolutely.
So what happens here is that when you get a sloughing off of this nucleic acid material, the protomorphogen that is in the cell itself that causes new cells to be created properly so that a new stem cell in the heart becomes a heart cell and not a liver cell. When those things get to be in abundance in the bloodstream, causing all kinds of allergic reactions, your body will simply start seeing the heart as the enemy. And so we have a protomorphogen for that, cardiotrophin, to stop the attack, which is the whole concept behind the medical idea of oral tolerization. Stop the attack. They'll use anti-inflammatory drugs. They've even found anti-inflammatory drugs will help someone with Alzheimer's because it will stop the autoimmune attack against the brain cell. But what do you do next? Well, you have to feed it, and this is where the genius of Dr. Lee comes in. Yes,
and that's why I love drenatrophin to stop an attack on your adrenals. Yeah. And then we also have Drenamin, which has the drenatrophin in it, but it also has the food.
The food for the adrenal.
So it's like a double whammy. I mean, I have women walk into my clinic with Drenamin clutched to their breast saying, "Give me my Drenamin."
Yeah. Or they'll do the same thing with thytrophin. Yeah. Or anytime I deal with somebody with a central nervous system problem, we give them neurotrophin to stop the autoimmune attack against the nervous system. Yeah. And this is, it's sad that medicine had to put this on the shelf because they didn't know what to do once the drug inhibition was given, because this is where the nutrition comes in.
Right.
And it's just not a part of Western medicine education. Nutrition does not fit in the Western medicine model.
Right. Well, and you were talking about how fast that the heart responds. And I've been doing some investigation into the brain and finding that the brain can respond as equally as fast to the right nutrition.
Wow. Now they've got a new device to measure that.
Yeah. I picked up a device called a Wavi. Med.com is their website. And Wavi is a very simple in-office EEG device. So we can do EEGs.
Electroencephalogram.
Correct. We can measure P300 wave. We can measure brain voltage. We can measure physical reaction time. And I've had patients, a chiropractor actually, that had 2 strokes, and we did a brain scan on him a month ago, and I had him chew an herbal supplement, Bacopa, which is a brain formula. And I immediately did another brain scan, and we raised his electrical voltage 2 points, which when you're talking from 4 to 7 is pretty good, So did you try neurotrophin PMG? I didn't try neurotrophin PMG on him for different reasons, but I have used neurotrophin PMG on my son, where we increased his brain activity instantly 200%.
Woo!
just by taking that autoimmune assault off of his brain, which we know his brain isn't good because he had so many concussions when he was a baby, probably 3. I mean, yeah, I know, Parent of the Year award for me. But
did he just fall?
Yeah, he fell out of a stroller at the zoo. He fell out of a grocery cart at the grocery store. I wasn't there. I can blame that one on my wife. So we had these little injuries when he was a kid.
No, but that's not funny, because I had a friend whose son fell out of a grocery cart too and was never the same. And I'm sure he just needed some neurotrophin PMG and then good animal foods and therapeutic supplementation to some extent. And this forbidden information is nowhere.
No.
Well, that's kind of why
I almost get upset.
Yeah.
When you say
it's criminal.
They think you're crazy. You're doing a heart graft on a person and you go, your AFib has an autoimmune component. Well, my cardiologist never told me that. And I just come back, well, your cardiologist obviously hasn't read the information from the Backey Institute, have they?
No, and they don't keep up on the latest research themselves anyway. So, I find nothing against medicine. They save lives every day, but they run anywhere from 20, 30 years behind in the research.
Well, they have a half a day.
And it has to fit into pharmacology.
Yeah, they have a half a day of teaching on vaccinations. They probably have a few hours teaching on nutrition, from what we've heard.
Well, yeah, I've researched this quite a bit.
Right.
They will be taught that a vitamin B1 deficiency will cause beriberi. Vitamin 3 deficiency will cause pellagra. But they are never taught that an abundance of vitamin B1 will cure beriberi.
Right.
That an abundance of vitamin B3 will cure pellagra.
But not the synthetic.
Well, no, food. We're talking about food, yeah.
Partly to their defense, though, Jack, what are they using? They've used a synthetic thiamine, and they did not see the results.
Right. Yep. So what could they think but that?
Yeah.
Yep.
Yeah, that it doesn't work. Every study that says, we found vitamins don't work, at the very end it will say, well, we found when you use the whole food, they don't have these.
Yeah, a lot of the old early, 2020 and Frontline and the other evening primetime TV news programs, we find out, they'll come out and badmouth vitamins. 250 milligrams of vitamin C, which of course was ascorbic acid, will cause hardening of the arteries. Vitamin E will cause heart disease. Vitamin A will cause birth defects. Mm-hmm. But when we did tests with these vitamins extracted from food, we did not get these negative effects, which is about the last 30 seconds of an hour-long program on the subject.
Let's go back to your son. Tell me what happened with your son.
Oh, well, we were doing a brain scan on him. It was the first time I've ever seen the device.
How old?
My son is 31.
Okay.
He's 31. And so we did the brain scan on him, and I looked at Paul, who is the WABI guy. And
what's WABI stand for?
I think it's just a name. I don't know that it does stand for anything, oddly enough.
Google made it big, so WABI maybe can.
But I said, so can we do another scan? I'm going to have him, take some supplements. And he's like, oh, yeah, sure, absolutely, let's do it. He goes, what are you going to give him, some fatty acids? And I just looked at him and I smirked.
Yeah.
Because I had the ace up my sleeve, right? So I had my son chew up some neurotrophin because I know there's an autoimmune attack on my son's brain.
Sure.
I know it because I've seen it over the years and, different things that occur with that. And so when we got done with the scan and we were comparing the two tests, he looked at me and he goes, how the hell did you do that?
Wow.
I said, I didn't give him fatty acids. I gave him neurotrophin PMG. He goes, what's that? I said, DNA of brain tissue, because he's got an autoimmune assault on his own brain. I'm taking the autoimmune assault off. So his brain instantly now, within minutes, has a chance, has that window of opportunity, has that time, Mary, where it wasn't being attacked. It could actually settle down and electrify.
So my next question is, how come he's 31 and you're just giving him neurotrophin PMG?
Mary,
Bad parent. Well, I know. I understand. I have a 20-year-old that I can't control anymore. So
the boy was raised on standard process.
Okay.
The boy was raised on chiropractic. The boy moved out of the house when he was 18.
Okay.
So the boy made his own decisions.
I get it.
I wish to God it were different.
Yeah. Well, and I think about this friend of mine, and her son grew up semi-disabled. They never could figure out what was wrong with him. Of course, I was fully medical back then. This was 30 years ago. I should look him up. He's probably around 30. But it was just a simple fall out of a shopping cart and hit his head.
Yep.
So these concussions, I'm looking at it really simplistically, but when you hit something so hard, that nucleic tissue, that DNA must get shoved into the bloodstream, especially if you're older. And is that what causes the concussion, the problem with concussions, the autoimmune?
Yes. That's why they don't truly ever heal up.
And then repeated concussive injuries in the same area.
It magnifies it.
Yeah, because it takes a while for nerve tissue to heal anyway.
Yeah.
Because it's contained inside of a structure that won't swell. Right. Like if you broke your arm, we'll set the bones. There's going to be a lot of swelling that takes place, but the swelling goes down, the body heals. You do something tragic like that to the brain through a serious car accident, hitting the windshield, falling on cement and banging your head, bicycle wrecks, as Lowell was pointing out, and banging your head, even with a helmet. Don't think that you didn't get a concussion.
That helmet's not going to stop the concussion.
No. It may stop you from busting your head open, but it's not going to stop the brain from hitting the inside of the skull.
Exactly.
And because it takes a while for nerve tissue to heal, and then a repeated injury in the same area on already damaged, or whether some lesion that's present on the surface of the cortex is just going to make it worse. Yeah. It could get deeper. It could spread further. And you start getting into very sensitive areas of the brain. A small concussion can have lifelong disability.
Well, isn't it true, though, Jack? If I have one protein in my blood, I don't need a big immune reaction. But if I've got 1 trillion proteins in my blood...
See, that's a different matter. That's a totally different matter. And then the immune system, like this robot from the day the earth stood still, is not sitting around trying to decide, well, it was just a coach that shouldn't have taught the little kid how to do a header with a soccer ball. No, it goes after the enemy, and the enemy is an active protein in the bloodstream.
Right.
And that's, as good and resilient and powerful as our immune response is, which we would not be alive without it, it can be unmerciful at times when it starts attacking us.
Dr. Lee talked about this antigenic protomorphogen, pneumotrophin PMG, and he worked with 10 terminally ill people, and they were all healed and they all lived. He talks about it in his, I think, the protomorphology book, which you can get at Saline River Press, all of his writings. You guys can do your own studying. If you go to salineriverpress.com, and then I forget the tab, but you
Historical Archives.
Historical Archives.
Yes.
Historical Archives. Yeah.
So I'm just going to read real quick what he did, because it's just so powerful. I need to. And Lowell, I know you've heard this 100 times, but
well, we have to kind of sum up this whole thing anyway, because it's been almost an hour. So this would be a good summary.
This is so good. So this is Dr. Lee talking. So to test this out, we extracted beef lung with the proper solvents and removed the antigenic protomorphogen and put it in tablet form and supplied it to a patient with lung difficulties. Lung difficulties, lung irritations, patients who are obviously in trouble where their lungs were not healing up as they should. Well, we immediately got some of the most surprising reactions. One of our first tests was on 10 terminal cases of tuberculosis in a sanitarium in North Carolina. Each of these patients recovered instead of dying. And according to the best judgments of the physician in charge, they were all supposed to die. You know, the only patient that's legitimate to experiment on is the one that's, according to all intents and purposes, is going to die anyway. When you're using nutritional factors that are extracts of natural tissues of meat animals, you don't expect to kill a patient because you know they're not toxic. So experiments of this kind, I think, are far more legitimate than the experience with wonder drugs in which you don't know whether the remedy is worse than the disease. At any rate, the sanitarium immediately decided to go ahead and run a test on 100 patients with very similar results. In other words, these terminal people didn't die. Well, I'm going on here. Well, since then, we have found, for instance, here's a fireman with burned lungs from inhaling hot gas, and he's not recovering, i.e., is not rallying. He's going down every day. We gave him some of these lung extracts tablets, and he immediately turned around and starts to get well, and his lung heals up in a remarkably short time. That's another type of a case. You can see that these would all be predictable. This fireman had burned lungs, and his blood had absorbed lung proteins and carried them off to the disposal department, where they immediately manufactured excess antibodies, which is automatic, and this antibody in the blood supplied the lungs with an inhibitor factor which prevented healing.
That's 1954.
1954, yeah.
And they were just beginning to say, hey, you know what? Maybe there is something to this autoimmune disease thing.
Right. No, something else I think real quick that I think might be important to point out is that these protomorphogens, especially ones for like the thyroid and brain and that kind of stuff, they're hormone free. There's no hormones in there.
No. Yeah.
They're not going to like throw the body out of balance. These protomorphogens are going to be regulatory in effect. They're going to downregulate a hyper organ, and they're going to upregulate a hypo organ.
Balance it out. Yeah, that's the same with our ageless thyroid. The desiccated thyroid we have in there is certified hormone free.
Wow.
So, anyway, I it's what you can see why we named our long life energy enzyme supplements Lee enzymes. We named them after Dr. Royal Lee. He was so brilliant with all of this. These protomorphogens, these PMGs that he made, are one of the greatest gifts given to humanity.
Absolutely.
By Dr.
So we have protomorphogens for the nervous system, for the heart, for the liver, for the kidneys, for the testicles, ovaries, uterus, for
the eyes,
the thymus, oculotrophin. I just had eye surgery on both eyes, and I went through a bottle of oculotrophin.
Yeah,
minimal inflammatory reaction.
Yeah, he pounded the oculotrophin.
Oh yeah,
chlorophyll.
there was no issue about it. I must be bone. We have it for the bone, lungs,
hypothalamus,
skin
dermatrophin. Renifood for the kidneys, thymus. Hepatrophin for the liver, spleen PMG, prostate PMG,
testicles,
the orchic PMG.
Yep.
We have strophin for your bones. Did you say that? There's a whole bunch. And Dr. Royal Lee said, let's see, where's that quote that Mark Anderson says over and over and over again about that's the way we age. Dr. Royal Lee, I can't find the quote. But it's the one he talked about.
Well, yeah, that as we get older, more and more bodies come under antigenic attack, and he says that's the thing that is contributing to the aging process.
Yeah, and we have somebody another mentor in Standard Process that is doing an experiment and is taking 17 protomorphogens, and every other day he switches. Monday, Wednesday, Friday, he takes, I just dropped it, about 6 or 7. And then Thursday, Friday, Tuesday, Thursday, Saturday, he takes the others. And he did a heart test he did a HSR, heart sound recorder, after he'd been doing this, Lowell, do you know, about 2 or 3 months?
Right, something like that.
And his heart scan came out almost perfect.
Yeah.
And the heart is such a reflection of the health of your body. So I was really, really impressed with taking all these. I mean, that would be pretty expensive, although the protomorphogens are not that expensive, but
And you don't really need that many.
No, it's just an experiment. But as far as Dr. Lee says, that's what happens. Eventually that's how we die. It's kind of like, it's kind of like all diseases turn into autoimmune disease. It's like decomposing while you're alive, and your body attacks.
Yeah, and then it's, because I'm sure it's the same thing with Dr. Keppel here as it is with you in your nutrition practice, me with my practice. Oh, it's just so awful to age. Oh, I'm just told that my problems are because I'm getting older. And I say, stop right there.
Yeah.
Right.
Stop right there. It's because of malnutrition. Oh, no, I eat well. No. Let's back up a bit. Hey, just before we wrap this up, I just wanted to mention for a moment, those of you who are listening right now, before we go on and talk more about the protomorphogen concept, the concept of autoimmune disease, I just want to bring up our free symptom survey really quick that we offer on the homepage at forbiddendoctor.com. If anything we have said today might spark an interest in you, I think I might have a problem with my heart. I think I might have a problem with my skin, or, and you're having, and whatever, from your head to your foot, I want you to take the symptom survey. It's free. At forbiddendoctor.com, you just click on the symptom survey link. It's the most comprehensive survey you probably will ever take. It has tons of questions. After you're done, you have the opportunity to have a free 30-minute phone consultation, and you'll be given a personalized protocol. And this saves you money in the long run because you won't be taking supplements you don't need. And of course, all of this is at no charge to you.
And if you do decide to purchase the recommended supplements, you can get them at a 10% discount if you sign up for a text blast. And these text blasts give you fantastic coupons every single week. Just text the word healthy to 41411. 41411, and we will text you back a coupon code, which you can use on our website, forbiddendoctor.com, when you check out, or you can call our office at 801-523-1890, and they can help you sign up for the text blast. And remember, your patronage of these offers keeps the podcast on the air.
So we found, you want to quote it or you want me to do it?
You go ahead.
Yeah, what Dr. Lee very famously at one time was saying, says, old age in general is probably the development of those antibodies, one after another, to one specialized tissue after anher. And
so if you can stop those antibodies.
Yeah, it's not that your organs break down in order. Mm-hmm. First there's the left eye, then there's the right kidney, and then there's the left lobe of the lung. And no. As malnutrition sets in, and by malnutrition, I mean you're not getting the essential food elements into your body that Mother Nature intended. You're getting way too much overly processed foods. You're missing vital nutrition. The body simply starts to break down tissue-wise. It breaks down chemical-wise, tissue-wise, psychological. Everything begins to suffer. And then it starts to show up as symptoms. And as more and more tissue begins to be destroyed or starving or whatever else, the immune system has to come in and clean things up. And that's what Dr. Lee's referring to. Here, this is, I'm 69 and I was running around in diapers when he said this stuff. And that's how far medical research is behind this very important problem that they themselves said this is absolutely essential to maintaining the health of the human body by stopping these autoimmune attacks.
But they didn't have a drug for it.
How many autoimmune diseases are there now? I think there's almost 100.
Yeah, it's very.
There was 80 when I first started talking about it 20 years ago, and now I think there's 100 autoimmune diseases.
Well,
I don't know. I think they discovered another 100 while we've just been talking.
Yeah, probably so. And so what's the standard medical approach? Anti-inflammatories. Yeah. That will work.
Takes care of the problem.
Anti-inflammatory stops the autoimmune attack. Mm-hmm. Yeah, it washes the antibodies out of the system. There's a form of paresis, I forget what it's called, that washes the bloodstream. The bloodstream goes through a machine. It comes back into your plasmapheresis. Thank you. Plasmapheresis to wash the antibodies out of your bloodstream.
It doesn't fix the problem.
For a week or two, you're okay, but the autoantibodies start building back up again in a rather strong population because the underlying inflammatory problem that created the tissue destruction hasn't been addressed.
Yeah, I always say enjoy the peace that comes from foundational healing rather than the useless frustration of managing symptoms.
But that's what our entire medical industry is based upon, the management of symptoms.
But that's why we're here.
It's essentially, I heard this mentioned on a news program the other day. It's designed, the idea of mitigating symptoms is nothing more than keeping you sick.
Yeah.
It's to keep you sick. It's not to get you well. Healing people, getting people well is a very bad business model.
Yeah. We can go on forever with that.
All right.
Okay, Lowell.
Yes.
Give us some more pearls. We're going to wrap this up.
Some more pearls.
I mean, that was the pearl, those two different types of protomorphogens, which I'd never heard before. And you talked about it in a webinar I listened to, and I was furiously writing this down. And so that's why I wanted you on here. I wanted you to explain the two different types. And it's just fascinating how intelligent the body is.
Well, not only that, but it also goes a step farther on these endogenous, our own natural protomorphogens, and those are the blueprints for our body, so that my body now knows how to reproduce a healthy liver cell for me. But there's also a whole nother cascade with these endogenous blueprint protomorphogens that takes place, and that is, how do they get and what tissue accumulates them? For instance, for me and Jack, these endogenous protomorphogens have to be accumulated in our testicles. Mm-hmm. Okay, for you, they have to be in your ovaries. For everybody else, it doesn't matter what sex, we need to also collect them in our parotid glands and also in our pancreas. Why? Why does our body need to have these blueprints of all of our cells in those three specific organs?
Oh.
Well, enlighten us.
Oh.
I wanted to tease you so that we could do another podcast.
Well, tell me that. So you're saying they're ovaries, the testicles, the parotid?
It's obvious for the ovaries and the testicles.
Yeah, you need that.
But why the parotid?
Parotid, and what was the other one? Well, Pancreas.
Yes.
Ooh.
They store our blueprints.
I didn't know that. Maybe that's why the Lee enzyme has such an effect on dementia. When people take our long life energy enzymes, it releases those nerve protomorphogens.
I don't know. That's a good question.
Yeah.
Hey, did you give this quote?
No, I will though, but just a minute. But bringing that up, I'm sorry, I still want to finish this. Dr. Lee talked about pregnancy and protomorphogens. And he says pregnancy is a condition in which there is an enhanced mitotic activity in the developing embryo.
Right.
Such enhanced mitotic activity must necessarily result in the production of abnormal amounts of protomorphogen. Right. These must be eliminated. Otherwise, the effect on the fetus and the mother would be disastrous. The onset of pregnancy is often accompanied by nausea, the so-called morning sickness. We feel that this may be caused by the additional protomorphogens eliminated by the embryo into the maternal circulation.
Right.
Yeah, you consider how fast tissue is turning over. Right. In that explosive period, especially in the first 8 to 12 weeks. Then it's easy for some of that tissue debris, because as cells are coming, cells are dying, cells are developing, cells are being sloughed off. And initially, in the first week to 10 days, a lot of this is taking place. Some of that cellular debris is getting into the placental blood, into the mother.
It's in the maternal circulation.
Yeah, so mom gets it through the placenta.
So do you want to be transparent enough to tell about what happened to you this morning?
My placenta?
No. You were talking about nausea.
Well, I've started. Lately, I've just been getting up a little too many times during the night. So I started a whole new comprehensive program on my prostate. And
Michael Gaeta's from our last podcast.
Yeah, and of course it revolves around prostate PMG to stop the autoimmune attack against the prostate. Well, I took a handful of them. I thought, a little bit's okay, then a whole bunch is even better.
And he was so nice.
Oh my gosh, I thought for about an hour and a half. after I took those, and I've taken protomorphogens for over 20 years, but 3 here, 4 there, maybe a couple times a day, and that's it. I don't know how many I took. I think it's up around 15, 16 of them this morning. Just for a good start, that kind of a thing. And I was so nauseous, I could barely move.
Yeah. Best to experiment on yourself, Jack.
Yeah.
That's right. Next time I'm going to get Mary the prostate PMG.
What hormone is vitally important in all of this protomorphogen activity?
Now, what is you keep fading in and out? Yeah, the what hormone?
What hormone is vital to this PMG, this protomorphogen blueprint?
For any PMG?
Anybody, any PMG.
I don't know. HCG?
Thyroxine.
I got it.
Thyroxine.
I got a star right on my forehead.
Well, that only makes sense.
Thyroxine. So you were saying.
Let's explain why. Let's explain why. People are going to want to know the answer as to why.
For sure.
Well, because the thyroxine controls the metabolism and it controls the unfolding of the genetic material.
That's right.
So, but the thyroxine also will accumulate the endogenous blueprint protomorphogen and transport it to the testicles, ovaries, parotid, and pancreas.
Really?
Yeah.
So if you're not producing thyroxine.
So if you are hypothyroid.
Yep.
There's a whole host of problems that could be following that.
And this is why the hypothyroid mom gives birth to the Down syndrome baby.
Yeah.
Wow.
Thyroxine doesn't allow that genetic material to really unfold and develop.
Well, maybe we will need another podcast with you, Lowell. This is fascinating stuff.
Yeah, this is, because we need to wrap this up.
Okay, so this incredible. Who knew the answer to autoimmune diseases could be found in our diets?
Well, that's a good question, Mary.
Yeah. I mean, if we'd just eaten all these glands and all these organs all the time, it would continue to stop the autoimmune attack.
Right.
But it also would help us rebuild our organs and glands and skin and hair and lungs and eyes and everything. Mm-hmm. So that's hidden in our diet. This has been hidden from you. We're told to eat salads and broccoli and fruit. We're not told to eat these protomorphogens, this brain tissue. That's why we like sausage. I mean, you get parts as parts. Can you imagine if this little boy that had fallen out of a shopping cart had been fed sausage? Because she probably wouldn't feed him brains. But I'm sure he had cold cereal for breakfast, right. Sandwich with Wonder Bread at lunch, and dinner, got to eat your vegetables, eat that spinach.
Eat corn. Eat your corn.
Eat your corn. They'll eat corn. It's sweet. They'll eat peas.
But corn,
it won't help them rebuild this.
Because of sugar.
The medical society knows that autoantibodies are the culprit, but they have no idea how to support and feed the organs and glands after diverting the autoantibodies with autoantigens like anti-inflammatories and immunotherapy. Who knew that the malnutrition and toxicity of the last few generations has caused these autoimmune diseases? Clear back in 1951, Dr. Royal Lee said it best. Go ahead.
He said, one of the biggest tragedies of human civilization is the precedence of chemical therapy over nutrition. It's a substitution of artificial therapy over nature, of poisons over food, in which we are feeding people poisons, trying to correct the reactions of starvation.
Yeah.
I don't know how you could say it any better than that.
Right.
Using drugs instead of food to fix the problems of starvation. But we don't think of Americans starving. But that's what the aging process is, being accelerated by the autoantibody attack of an organ that's starving.
Right.
So you can eat it or you can take it, You
can eat the liver, or you can take liver concentrates in supplements. That's what standard process is all about.
PMG.
Or do both.
Do both, yes.
Well, that's the idea. It's one thing. So part of the day, you're taking protomorphogens to stop the attack. The other part of the day, you're taking the supplements that rebuild the organ.
Yeah.
Pure and simple.
Yep.
Provable with an HSR. So thanks, everybody. And please go to iTunes.
Thank you, Lowell.
Yeah, and thank you, Lowell. Go to iTunes, rate the podcast. If you liked anything you've learned so far, please go back to iTunes and rate it. We would so appreciate it. With your simple rating, this forbidden information can rise in the ranks and we can spread this to the entire world. So you guys, if you've enjoyed this at all or enjoyed any of them, please go to iTunes, leave some feedback, just rate us. It would be very much appreciated.
And don't forget to tell your family and friends to take our symptom survey. It's the easiest way to find out what's going on in your body. And you can also come in for a heart sound recorder or a bioscan. And it's much easier and much cheaper to get a personalized protocol than to just try to guess.
Just run off willy-nilly and buy
and the symptom survey is free. The HSR and the bioscan aren't free, although they're not very expensive. But still, the symptom survey is free. Just go to the homepage on our website, forbiddendoctor.com, and take the symptom survey.
The statements made in this podcast about specific products have not been evaluated by the United States Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent disease. All information provided or any information contained on or in any product label or packaging or this podcast is for informational purposes only, and it is not intended as a substitute for advice from your physician or other healthcare professional.
Thank you for listening to this forbidden information, and thank you, Dr. Keppel.
Join us next time for another in-depth discussion of forbidden knowledge.
Yes, we will see you then.
Yes.
And
so the statements made in this podcast about specific products have not been evaluated by the United States Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent disease. All information provided or any information contained on or in any product label or packaging or this podcast is for informational purposes only, and it is not intended as a substitute for advice from your physician or other healthcare professional. So join us next time for another in-depth discussion of forbidden knowledge. We'll see you then, and we will probably stay audio for a while.
Yeah, this has been fun. We'll see you then. Bye-bye.